Hi guys, with lecture number 4, I'm Dr. Rehman. Today we are going to discuss type of cell injury. As we have already discussed, when there is a stimuli for a transient, means for a shorter duration of time, the injury would be reversible, and if the stimuli is persistent, the injury would be irreversible. So in this lecture we will discuss reversible injury. So let's start reversible injury. As we know, the most common cause of cell injury is ischemia. Ischemia means decrease oxygen. Simply, when this is a cell, the blood vessels, there is the presence of oxygen, and the oxygen goes towards this cell or tissue. When there is a decrease in the blood flow, means ischemia, hypoxia occurred, which is the most common type of cell injury. So ischemia leads to decreased oxidative phosphorylation in mitochondria. As we have discussed that in the cell an organelle is present called mitochondria. In mitochondria, ATP formation take place with the help of oxygen. ATP formation take place with the help of oxygen. So when there is the deficiency of oxygen, there is a stress produced on mitochondria and decrease in the formation of ATP. So decrease in ATP production means decrease in 5 to 10% of the normal ATP production. For example, this is a cell. Sodium potassium pump work by ATP. This is a normal cell. When there is a normal cell, sodium potassium pump work properly because of ATP. Sodium goes outward and potassium goes inward. When injury take place, there is no ATP, so sodium potassium pump leave its function, and sodium, instead of going outward and potassium going inward, reverse their movement. Sodium is accumulated inside and potassium is going outward. So when sodium goes inward, water also moves in the same direction. So what happened? The first sign is when sodium is moving inward, water is also moving inward, the cell becomes to swell up. So swelling is the first sign in the reversible injury or irreversible injury. First sign in the injury is swelling of the cell, except for apoptosis there is a shrinkage. We will discuss in irreversible injury. Now the second change, the first change in the cell was swelling. Now the second change is vacuolar degeneration. As water is accumulated inside, so there is, due to water there is a degeneration, which is called hydrophobic degeneration due to intracellular water accumulation. So the cell becomes cloudy, and it is also known as cloudy swelling, and its example is acute tubular necrosis of the kidney. The third organelle change is ribosomal detachment. Ribosome presence on the endoplasmic reticulum detaches, and the fourth one is endoplasmic reticulum swelling. As water is moving inward, endoplasmic reticulum swell ups. There is a microscopic examination. There is a cloudy swelling due to water accumulation inside. So this is hydrophobic change or cloudy swelling, and its example is acute tubular necrosis. Now, for example, this is mitochondria. A normal crista is present. When the cell injury happens, this crista disappear, and when the crista disappear, The swell, instead of flattened shape, achieves a circular shape because mitochondria swell up, and there we can see small amorphous densities. Small amorphous density means the phospholipid are present along with the calcium. And most important factor for cell injury is calcium. And which calcium? Serum calcium or cytoplasm calcium? Cytoplasm calcium, cytosolic calcium. So in mitochondria, the cresta disappear, and due to disappearance of the cresta, water moves inwards and mitochondrial swelling happens, and you can see small amorphous densities. Now the next change is when sodium in water is moving inward, the calcium also moves inward. When there is a mild increase in the calcium in reversible injury, while there is enough calcium raise in irreversible injury. And this calcium is cytosolic calcium. When the calcium moves inwards, it activates an enzyme present on the cell membrane called phospholipase, and this phospholipase do what? This phospholipid combine with the calcium and make a structure which is called myelin figure. So myelin figure is a combination of phospholipid and calcium, and it is seen both in reversible and irreversible injury, but in irreversible injury this is most prominent. Now what changes will occur in the nucleus in the cell injury, in the reversible cell injury? So it is very simple. For example, this is cytoplasm, this is nucleus, this is a basophilic, this is eosinophilic. In normally this is eosinophilic. Cytoplasm is basically eosinophilic and nucleus is basophilic. And granular or fibrillary chromatin is present. When injury takes place, there is a disaggregation of this granulation or fibrillary nuclear chromatin. Got it? So these are the changes in the cell organelles take place when the cell become injured in reversible injury. Let's revise it again. As we have discussed type of cell injury in transient stimuli, reversible injury, and persistent stimuli, irreversible injury. Injury is due to ischemia, decrease in the oxygen, and it produces oxidative stress on mitochondria. So there is a decrease in oxidative phosphorylation because ATP production is decreased, and due to this ATP production, the first sign is cell swelling. As sodium potassium pump leave its work in the sodium and water accumulate inside and cell swelling take place. But remember, for an apoptosis, the first sign in the injury is cell shrinkage. The second one was vacuolar degeneration as water was accumulated inside. The third chain, ribosomal detachment and endoplasmic reticulum swelling. The fourth one, mitochondria cresta disappear, and due to disappearance of cresta, the mitochondrial swelling take place, and there you can see a small amorphous densities. The most important factor for cell injury is calcium ion, and when the calcium moves inwards, it activates phospholipase, and this phospholipase release phospholipids from the cell membrane, and this phospholipid combine with the calcium and make a ring called myelin figure, horn like structure called a myelin figure. And in nucleus there is a granular fibrillary chromatin is present, and when disaggregation of the granular or fibrillary chromatin take place, it means that the injury is going to start it. If you like this tutorial or you have any question, please ask in the comment box, and we will cover the whole pathology in upcoming 90 days for USMLE, NEET PG, any kind of exam. And if you need the notes of these lectures, join our WhatsApp channel or the WhatsApp link, a bit link, where you can get these notes. Thank you. Have a nice day.